Maintaining physicians and nursing staff at the Shaunavon Hospital continues to be an issue of concern. Over the past several months, several closures of the hospital have taken place due to the fact that an insufficient number of medical staff were available for on-call service. And according to this release from the Cypress Health Region, disruptions in emergency outpatient service and patient admissions will continue through the month of May. A distressing situation for the town's mayor and residents of Shaunavon and surrounding area.
I have lived in Shaunavon for over 30 years, and never has it been, this critical in terms of the service not being provided, to the people in the area.
And following a recent meeting between the Health Region, Town of Shaunavon, surrounding municipalities, and the province, a short-term solution was announced for the month of June. A Swift Current physician will commit his service on Tuesdays and Thursdays for the Shaunavon Hospital, while still attending to his own patients back in Swift Current. How long this physician services will be available remain to be seen. And as far as tapping into the locum pool of physicians, these contractors are busy, as national exams are being held across Canada for physicians in general. Despite all of the hurdles in place, the Cypress Health Region feels confident the Shaunavon situation will be rectified. However, it won't happen overnight.
They're often incremental in how we're able to add resources in, so it's often not just the ability to flip on the switch and everything's in place. It takes time to put these things in order. The other thing that we know is that it's really important that we do good community consultation. I think in the past, organizations have really felt that they had the answers, and we know our biggest successes and our longest term solutions come when we do that community engagement. We actually speak to residents in that area about what it is that they need. Are there other ways that we can provide health services? What role does the community play in actually creating a healthy environment that leads to prevention and potentially not the need for people to be presenting in emergency departments?
Mayor Dickey agrees that open communication between the town and the health region is crucial in working towards a solution. But in the end, an overall change in the system needs to be addressed once and for all.
We just went through a situation here in Shaunavon where we have a physician who does not want to leave the community, but will not stay and work under the conditions that are there. And we have nurses that are leaving for the same reason. And those are situations that we cannot help with. Those are internal issues that have to be dealt with by the health region. And if you haven't got the internal makings of an organization or company, if you haven't got happy people working for you, then there's a problem.
Concerns which the health region says it hears loud and clear.
Just for that geographical area, we think we need 4 physicians to be able to provide services out to the rural communities surrounding Shaunavon, as well as providing that emergency service. So when you look at the number of physicians who have been trying to maintain services there for the last 2 years, they've been working well over capacity. And we really need to challenge ourselves to find different kinds of solutions. So that is where that shift needs to occur. Discussions with community members need to take place and really think about, are there other ways to do this and provide an effective, safe, quality service that meets the needs of the community.
And until this situation is fully resolved, residents of Shaunavon and area will be left knowing that future disruptions in service at the local hospital will be imminent, while hoping that an emergency situation does not arise during one of the scheduled hospital closures in Shaunavon.